Hi, I'm Dr. David Geyer, orthopedic surgeon and sports medicine specialist, and I provide education and commentary on injuries and injury treatments and injury prevention in sports and exercise for athletes and active people, probably much like yourself, so that you can stay healthy and perform your best. Now, athletes want to compete. They want to play, they want to be in the game, they want to win. I get it, it's one of the best parts of sports. And even if it's just exercise or running road races, you want to do the best you can and you want to be out there. And let's be fair, young athletes, kids are no different. They want to be out there competing. You know, they got their friends playing and it's fun and the competitive juices get going. They don't want to come out of a game any more than adult athletes do. But kids might be unique in the sense that they really don't want to let people down. They don't want to let their parents down. They don't want to let their coaches down. Certainly don't want to let their teammates down. And so one of the things that as orthopedic surgeons, and especially an orthopedic surgeon that works in sports medicine that I see a lot, are kids that won't tell anybody that they're hurting. They don't want to let people down. And see, one of the problems in youth sports is that so many of the injuries are overuse injuries. Not so much traumatic, even though those can happen where there's a specific event and somebody gets hurt, but basically this overuse injury that starts as maybe a sore shoulder or a sore elbow or a sore foot or ankle from running, and it's not a big deal, and they basically don't say anything. They keep pitching through it if it's the shoulder or the elbow, or they keep running through it if it's a bone in the foot, and don't say anything about it. They want to stay out there, they want to keep performing, not wanting to let you down as a parent or you down as a coach, and so they push through it. But the problem with pushing through pain is that stress can actually make the problem worse. And what may have just been a very minor ache or pain can become a stress fracture or a torn ligament or something much, much worse. May shut them down for weeks, may cost them the season, maybe they even need surgery. And again, this gets back to they're afraid of telling the coach, telling their parents. And if we put so much pressure on kids to perform, if all we're talking about is basically winning and statistics, they may not be likely to tell you. And it's critical that we basically know that there's a sign of a problem. Yes, when they really start to hurt, we may see their performance start to suffer, but we really need to watch for signs of a problem and listen for signs of a problem much sooner. So one of the things I'd recommend is, as a parent at least, and coaches, you can do this as well, is talk to the kids, maybe after practices or after games, but don't talk about winning. Don't talk about, stats or how the other team performed or coaching decisions. That puts a lot of pressure on kids, and honestly, they won't enjoy sports that much. Make it lighthearted, make it fun. Ask them, how did practice go? Did you have fun with your friends, or did anything funny happen? Or, maybe you take them for ice cream or something after the game, and do things that are fun, but build a dialogue that's not about winning and not about statistics, that's not pressure to perform, pressure to succeed. And eventually, you do that long enough, you'll build up a dialogue, and maybe your child, maybe a player on your team, if you're a coach, will open up and start telling you, my elbow's bothering me, or my shoulder's bothering me. They'll trust that you're not going to say, oh, it's no big deal, play through it. They'll trust that you'll listen and not think bad of them. And then, with so many of these injuries, again, especially if they're telling you about it early, a few days off, or maybe a little bit of work with a physical therapist, or maybe taping, could be any number of simple treatments. It gets better before it becomes a more serious injury. So talk to your kids, open a dialogue, but make it fun, make it lighthearted, so that they open up and trust you, so that you can basically do what's best for the kid. Keeping them from getting hurt is always the way to go. So, these honest dialogues without pressure are ways that you can keep kids out of my office, out of the orthopedic surgeon's office, which is always a good thing. Now, do you have kids that have had overuse injuries, and how did you basically learn that there was a problem? If you're a coach, how do you talk to your players about telling you about aches and pains and injuries that they may be suffering? Or if you're a doctor or a physical therapist or an athletic trainer, what advice do you have on, basically working between the young athletes and the parents and the coaches to open that dialogue and decrease the risk of overuse injuries. I'd love to hear your thoughts and your experiences. So below this video, please share your ideas. I would love to read them, and I would love for other people to basically learn from your experiences as well. Now, if you like videos like this and you want more information on sports and exercise injuries, injury treatments, and injury prevention, subscribe to my video channel. I record a couple of these videos every single week, and I'd love to deliver those directly to you. And last, go to my website, drdavidgeyer.com. There's so many resources that I only share with people on my email list. If you enter your name and your email address completely free, I'll share so many resources on ways to stay healthy and perform your best. I look forward to connecting with you that way as well. Thank you so much for watching. I really hope this was helpful. Youth sports injuries and overuse injuries in youth sports are something we really need to work to cut down. It's a big passion of mine. I hope this video was helpful, and I look forward to seeing you right here next time.